So I just want to do a really quick video while it's popped into my mind about what the reality is of making myself sick after eating. I've done that on and off for a very long time, and sometimes it's been only once or twice a month, and more. Sometimes it's been almost every day. And I started noticing about 2 years ago that, like, before 2 years ago, it felt like there wasn't really a consequence to it. It just gave me immediate relief. If I'd eaten so much I felt really full, then it was a kind of quick fix, and it wasn't enjoyable, and it wasn't, I didn't like doing it, but it kind of solved a problem, and there wasn't an immediate consequence. About 2 years ago, I realised, I looked in the mirror after doing that, and I noticed that I had tiny little red dots around my eyes, and kind of my forehead, and just my face in general. And I think they're tiny little burst capillaries or blood vessels, because, and I mean, I'm guessing, like, I'm sort of diagnosing this myself, but I guess maybe as I've got older, blood vessels get a little bit weaker, and I think the pressure in my head when I induce vomiting is so big that it causes little burst blood vessels, and it really scares me. That's pretty much the reason why I'm so desperate to stop that behaviour. The other behaviours, like the chewing food and spitting it out, I'm less worried. Like, I want to stop them because I don't want to be like this anymore, but I'm less worried about damage they might do to my body, whereas it really, the vomiting really scares me, because I now have this dialogue in my head where I think, what if I have, like, an aneurysm in my brain that I don't know about, and I make myself sick and it bursts? People have things like that just lying dormant for years, and it just takes something to turn it into something really serious. And I am terrified now of what might happen if I keep doing that.